Welcome to another episode of Ask Plexus DX. Today, we're diving into a question that's on a lot of people's minds. At what age does genetic diabetes start? It's a really important topic, especially as we think about how our family medical history can impact our health as we age. So let's break it down. First off, diabetes is a complex disease, and genetics play a significant role in its development. If you have a family history of diabetes, your risk of developing it yourself increases. This is especially true for type 1 diabetes, which often shows up in childhood or adolescence. If you have a close family member with type 1, your risk goes up significantly. Now, type 2 diabetes is a bit different. It usually appears after the age of 45, but here's the kicker. We're seeing more and more cases in younger people, even in their late 20s and 30s, particularly if there's a family history involved. So, knowing your genetic background is crucial for understanding your potential health risks. When we talk about the age of onset, it's not a straightforward answer. Several factors come into play. For instance, if you have a family history of diabetes, it's wise to start monitoring your health earlier. The type of diabetes matters too. Type 1 typically shows up in childhood, while type 2 is more common in adults. Ethnicity also plays a role. Certain groups like African Americans, Hispanic Americans, and Native Americans tend to develop type 2 diabetes earlier. And let's not forget lifestyle factors. If you have a genetic predisposition to diabetes and you're not taking care of your health, like maintaining a balanced diet and staying active, you might see symptoms appear sooner. So what can you do to keep an eye on your risk? Here are a few practical steps. 1. Know your family history. Talk to your family about any history of diabetes. This info is key to evaluating your risk. 2. Get regular checkups. Schedule those checkups. Your healthcare provider can run tests to check your blood sugar levels, which is super important for early detection. 3. Maintain a healthy lifestyle. Focus on a balanced diet rich in whole foods, fruits, and veggies. Aim for at least 150 minutes of moderate exercise each week. It really makes a difference. 4. Consider genetic testing. If diabetes runs in your family, exploring genetic testing can provide valuable insights into your risk. 5. Stay informed. Knowledge is power. The more you learn about diabetes and its risk factors, the better equipped you'll be to manage your health. Now, if you're interested in taking a proactive approach to your health, I want to introduce you to Plexus DX. They offer innovative precision health and wellness genetic tests that can help you understand your genetic predispositions. These saliva-based tests cover a range of areas, including nutrition, metabolism, and overall health risk management. You can find them at plexusdx.com, Amazon, and walmart.com. So if you found today's episode insightful, please like and subscribe. And remember, links to Plexus DX tests are provided below in the show notes. Thanks for tuning in to Ask Plexus DX. The following is an important disclaimer. Plexus DX is a personalized health report and laboratory testing service, which enables users to obtain science-based, evidence-backed health and wellness information based on their genome. Always consult a licensed healthcare provider for concerns about your health and before you stop or start any medical treatment.